Welcome back to MLT 120. In this lecture, we're going to learn how to prepare a blood smear. First off, we're going to use our anticoagulant EDTA tube, and we want to have fresh blood. Preferably, we want to make the slide within 2 to 3 hours of collection. The slides we use to prepare our blood smears must be clean slides. Now we need to go over the procedure for making the smear. We are going to use what we call a pusher slide to make the smear, and you can see the slide that's up on top at an angle. This is a pusher slide, or what we refer to as a pusher slide. Also, you can buy commercially available little tools that are used as pusher slides, but just a regular slide, a normal glass slide, works just as good for your pusher slide. You want to hold your pusher slide at a 30 to 45 degree angle to the top of the blood on the blood smear slide. So this is what's referred to as your blood smear slide, and you can see the spot of blood that's been put on the blood smear slide. And so this would be your 30 to 45 degree angle in between the slide that you're making the smear on and your pusher slide. The size of the drop of blood and the angle of the pusher slide controls the length and the thickness of the smear. If you lower the angle, you're going to make the length of the smear longer. So if you were to drop this angle down, it's going to make the smear longer. If you raise the angle up, so if you were to raise this up higher, it's going to make the length of the smear shorter. So once you have your two slides, you have your pusher slide and you have your blood smear slide, and you have your spot of blood on the slide that you're making the smear on, then you want to push the pusher slide forward, and it must be done in a smooth, quick motion. The pusher slide is pushed the entire length of the blood smear slide. The goal when making a blood smear slide is to create a feathered edge. This is where there will be an even distribution of cells to be viewed under the microscope, and the smear will be stained so cells are easily visible at only one cell thickness. So that's called a monolayer. You only have one cell thick, and this is the area that you're going to be looking at, and this is the feathered edge. You see the spot of blood. This is the application point where you put the original blood spot on, and all the blood got pushed this direction with the pusher slide, and the pusher slide would have been pushed the whole entire length of the slide, and it would have been pushed forward in a smooth, quick motion in order to create this feathered edge. Of course, this is where you would label the slide with your patient information. This is just another slide kind of going over the steps of how to make or create a blood smear. Again, you want to start with a small drop of whole blood on a clean slide. So that's what you're seeing here. And one thing that you need to do with your pusher slide, you want to pull it back into your blood spot. So you're not just going to lay it down into the spot and push it forward. You're going to kind of lay your pusher slide in front of the blood spot and kind of pull it back. This will cause the blood to go all the way across the front of your pusher slide, and it will create like a whole little line of blood going forward to create blood all the way across your actual blood smear slide. You want to maintain a firm grip and push smooth and quick forward with your pusher slide. You can see you're going to go in this motion, and you're going to push this pusher slide the whole length of the slide in order to create that feathered edge. You're going to push until your blood runs out. If your blood spot is too big, if you put too big of a sample, you're never going to get this feathered edge, because your blood's going to run all the way up to the end, and you're never going to run out to create that feathered edge. So there's some different reasons why we create blood smear slides. The first is when we're counting white blood cell differentials, we want to be able to differentiate between the 5 different types of white blood cells in peripheral blood. A lot of times it can tell us what's going on with a person by what blood cells white blood cells their body's producing. Also, our blood smears can help us evaluate the morphology or the shape of our red blood cells. Are they normal? Are they abnormal? Also, we can evaluate our platelets. We can count them, get a platelet count. Are they elevated? Are they low? Are they normal? So these are all reasons and purposes we use and make blood smears. Some limitations or things that can go wrong when making blood smears is if you do not use pre-cleaned slides. If you use dirty slides, they do not make acceptable or nice clean smears where you can see your blood cells clearly. If the smear is made too thick or the drying time ends up being too long, it may cause artifacts to form in your blood smear, so you can't read the slide as well. If there's an increased humidity in the room, this may also increase the drying time and cause artifacts. Old blood specimens may yield distorted or abnormal looking cells or incorrect numbers of cells due to the age of the specimen. So things have started breaking down in an older specimen, so that might be reflected in your blood smear, so you might not get accurate results. In your textbooks, there's some acceptable versus unacceptable smears. You can look at acceptable smears on page 203 and unacceptable smears on 204, but we're going to look at some images on the next slide of acceptable versus unacceptable. Also, you can look on pages 3 and 4 in your atlas. So first off, up here at the top of the slide, let's look at a bad versus a good smear. Remember, we're looking for a nice feathered edge, so let's look at the good first. You have a nice small blood spot placed onto the slide, and they've used a pusher slide, and you can see they've had a quick, smooth motion to create our blood smear. The blood smear has at least went 2/3 of the slide. You have your nice feathered edge. So in this area here, we know we've got a nice monolayer or one cell thick area for us to observe under the microscope. Now these slides are unstained, so you can still see the reddish color from the blood. Now this slide up here, you can see that this spot is quite a bit bigger. So this tech probably put a little too much blood on this slide to start with, and because of that, they run out of slide before they run out of sample. So like I was saying before, is when you put too much of a sample and you push it forward, you're not going to be able to create that nice feathered edge because you've got too much sample, and you're not going to run out. You're going to run off the slide with your sample. And you can just tell that this is too thick. And also you can tell by this little skip line, these little skip lines right here, that they didn't have a nice fluid motion going forward. They may have been moving forward at a good pace, but they weren't steady. They had these little skip marks, and they had too much of a sample. Their sample was too large. Down here are more bad examples of what can happen on your slide. Again, you have a skip mark here. They went all the way to the end of the slide. Looks like maybe they picked up at the end before they got all the way to the end, but still they probably had too much sample. This one still probably too much sample, and they picked up there at the end, but there's some skid marks. This one, it looks like they picked up and didn't make a feathered edge. This one they've got part of a feather here, but then it kind of stretches out here, so they weren't probably putting even amount of pressure. They probably had the right amount of pressure on this side, but then lifted up on this side. Again, probably too much, not even amount of pressure. There's a little drag mark right here in this one. They were going really good with their feathered edge, but then they have a drag mark here. So that's going to mess up the cells in this area. But a lot of these just have too much sample. They didn't have good pressure here, so you've got a pileup of blood. And again, it takes a little bit of time. It's a little bit of an art form to get your smears right. We're going to practice this in lab. Don't be afraid or worried if your first smears turn out to look like some of these. They're most likely going to, unless you have made smears before, or you've just, happened to be lucky and have a nice steady hand and end up with good smears right off the bat. But we're going to practice this, and everybody's going to come out of hematology being able to make a decent blood smear. So once you have created the perfect blood smear, you have that nice perfect feathered edge, which will be right here. You're going to let your blood dry completely on your slide. So this is what it's going to look like when it's dried. But then we're going to have to stain it. We're going to have to stain it with a right stain. So it's kind of a purplish colored stain. So once we stain it, it's going to look like this. The next step after staining is, of course, we have to read the slide under the microscope. There's a certain pattern that we go in when we read our slides. Again, we're going to be reading everything out here in this monolayer area out close to the feathered edge where there's only one cell thick. But we're going to go in this pattern of back and forth in order to count our cells. And for a white blood cell differential, we're going to count up to 100 white blood cells. And I realize we haven't looked at or identified any white blood cells yet, but that'll be coming later on in hematology. But this is the ultimate goal, to be able to create our feathered edge, create a blood smear slide that we can read and we can analyze and come up with some answers for the doctor in order to help diagnose our patients. This technique of reading a slide in this pattern of back and forth, is called the battlement technique. This concludes our lecture on preparing blood smear slides. We, of course, will be preparing blood smear slides in lab. We'll be staining them, and eventually we'll be reading our blood smear slides.